Very good morning, everybody. My name is Adithya. I'm working as an assistant professor in the Department of Medical Imaging Technology at Yenepoya Deemed University, which is in Mangalore. So I've been here for a couple of years now. Uh, so today I just wanted to discuss about something which you may have heard about, which is one of the eminent advancements in the field of medical imaging technology. It's something called as spectral imaging. So the topic for today is I've kept it as beyond conventional CT, revolutionizing radiology with spectral imaging. Okay. Uh, so let's quickly move on to the topic. So if you see, computer tomography has continued to evolve since its introduction uh, throughout the years, right? So like every time there are researchers, there are developments which is related to uh, I mean people the scientists try to keep the radiation dose as much as possible and increase the image quality as much as possible. So with the main goal of reducing the patient dose and providing a very good patient care to the individuals, CT has been evolving. So one of this main subject currently in the ongoing research in the field of CT is spectral imaging. Okay. You might have heard about dual energy CT, and then now you are hearing about photon counting detectors. All these are a part of spectral imaging, which uses energy information in the form of polychromatic X-rays for optimizing the tissue characterization. Okay. Because of this, the diagnosis has become very easy and very specific when you compare it with the conventional CT. So spectral computed tomography imaging encompasses a unique generation of CT systems based on the simple principle that uses the energy-dependent information present in the CT images, which was not in case of the conventional CT, right? So this technique, we use two X-ray photon spectra instead of one, which was being used in our conventional CT, which allows us integrate between materials which have different attenuation properties at different energies. We will anyways go through it, and then I'll try to make you understand as much as possible. So usually, as you all know, X-ray photons primarily interact with matter via photoelectric effect and component scattering in the diagnostic radiology level. Okay. So when an atom undergoes the photoelectric effect, the electron from the respective K shell, which is referred as the innermost shell, is taken out or it is ejected by the incident photon, which you all know, right? As the electron is like ejected out, there will be a vacant space which will be created, which will be occupied by the neighboring electron, whichever is there in the L shape, and then will be filled there, because of which there is a release of energy as a photoelectron. So, in short, like if I have to tell, the photon which is coming in should have sufficient energy to overcome the electron's binding energy, which is in the K shell, because of which the electron which is in the K shell can be ejected out, right? So this whole phenomenon is called as photoelectric effect, and the energy which is present within the electron to remove the it is required to what do you tell? Overcome the K shell binding energy. So it's known as KH. So there is what do you tell? There is a significant spike in the attenuation that reaches just beyond the energy of the KH. Okay. Once it is beyond the energy of the K shell, this peak is unique to every material. Like every tissue, whatever is there, it will have its own KH. So and it holds valuable information about the substance composition. So, almost if you see in a human body, almost all the areas will have low KH. that is up to 0.01 to 0.53 keV. But when it comes to elements like iodine or calcium, for example, they have higher kH, that is 33.2 kV and 4.0 kV respectively, making them sufficiently larger than the surrounding areas. Okay, and these are very important in the clinical settings. Okay? Uh, For example, if you have to take, so at if you are operating your system at 80 kV, a structure that contains no iodine, like iodine content and calcium content is not there, such as liver, or it has an attenuation based on its kH. Yet, but what happens is when you inject the contrast media or when the iodine content is injected into it at the same structure, it it has the higher attenuation of bringing it closer to 80 kV. Right. So as 80 kV is closer to 33 kV, that is like if you compare it with 140 kVp and 80 kVp, 33 is much closer, kV is much closer to 80 kVp. So the structures containing iodine will retain less attenuation as the kVp progress beyond the kH of the iodine. So therefore, whenever you're using two energies, right, it is possible to delineate two structures based on their attenuation differences between 80 and 140 kVp. Okay, so because of this difference in the attenuation, which is occurring in 80 and 140 kV, it becomes very easy for the diagnosis, or it becomes very easy for identifying the structures or what kind of structures these things. I mean, these structures are. So, so what happens is, uh, like for example, a few structures. For example, if I have to give you an example, calcium or iodine or barium, which all you use in your daily diagnostic purpose, right? So these atoms can be easily differentiated from other body tissues because of the energy that not the energy, because of the kH that they have, right? Uh, in this, so what happens is, so it becomes easy if you are, for example, if the two structures, that is calcium and iodine, are together. Okay. So if you are using a conventional CT, what happens is it becomes very difficult. At times, it becomes difficult to diagnose because both the HU values which will be given to those particles will be similar. But if you have 80 kVp and 140 kVp where the dual energies are used, it becomes very easy to differentiate the two structures. Okay, this is where spectral imaging will play a very important role. Okay. So as I told you, like if you see the conventional CT, you use only one spectrum. Okay, so like for if I have to explain it in a better way, in usually in CT imaging, so what you do, you measure the linear attenuation coefficient of different tissues as the X-ray beam passes through them, right? So each tissue will have its own linear attenuation coefficient, and depending on its physical density and the atomic number of the energy of the beam, it will have a different linear attenuation coefficient. But when the X-rays passes through the human body, it will pass through infinite number of tissues. Okay, a lot of tissues are there. Will pass through all those things with the different densities for a given position, making it extremely difficult to understand the interaction between photons and the matter. Okay. So, so to identify the linear attenuation coefficient, each tissue of the beam passes through multiple projections, and therefore, I mean multiple projections in a helical CT scanner. So during reconstruction, what will happen? Each voxel will be assigned to a Hounsfield unit, okay, based on the linear attenuation coefficient of the tissue, which is present in it, compared to linear attenuation coefficient of water, which is taken as reference. So in conventional CT, what happens? It uses only one X-ray spectrum, and the attenuation measurement is integrated based on that single spectrum for different tissues. Okay, so unfortunately, while using the beam, which has similar energy for a tissue, it is similar. For example, if you have a tissue like bone, okay, and you have calcium, okay, calcium deposition is there and bone is there, okay, because the attenuation is similar and the energy in which you have sent the radiation is also similar. Same Hounsfield unit will be assigned to both the structures. Okay, so it will become difficult for us as well as the radiologists to differentiate between these two structures, right? Because the nature of the type of radiation or the energy of radiation what you have given is same, right? And the type of structure that is with the density, if you see, or the atomic number, the calcium and bone is quite similar. So because of this reason, the Hounsfield unit, which is again the linear attenuation will be coefficient will be the same, and the Hounsfield unit, which is assigned also, will be the same. So this makes it difficult for the scanner to differentiate between two. Hence, both the structures will be provided with the same Hounsfield unit. So when it comes to the diagnosis part, it becomes different. It becomes very difficult to differentiate between two. That is where spectral CT comes into picture. Okay, spectral CT, what does it do? It will use two separate X-ray energy spectra, allowing the interrogation of materials that have different attenuation properties at different energies. Okay, if you are using 80 kV technique, so you'll have the attenuation will be different, and then when you're having the 140 kV technique, I mean kVp, again the energy will be attenuation will be different. So it will become very easy to differentiate between I mean two structures which is quite similar to each other when you had seen in conventional CT. So it utilizes a principle that differentiate that different materials show different attenuation at varying energy levels, and this difference in attenuation can be used for tissue characterization. Okay. Let's go to acquisition technology. As we all know, spectral imaging, you also call it as dual energy CT, which was one of the very few first generation of spectral energies, spectral imaging scanners. Okay, so if you divide the spectral imaging technologies, or if you divide the types of dual energy CT, you can divide it between source-based dual energy CT and detected. First, we will go and look into the source-based CT. Okay. So yeah, so first is dual source, dual energy CT. You will understand why the term dual source means there are two X-ray tubes which is operating at different energy levels, right? It is one of the very first generation dual source scanners where two X-ray tubes were used, and these two X-ray tubes are kept at 90 degrees angle 90 degrees to each other. Okay, it's kept in the same gantry, but the two X-ray tubes will be operating at the different kVp. Okay, so the average kVp of like higher energy tube, which is there, will be around 120 to 140 kV, and the lower energy tube will be around 80 to 100. Okay, these two tubes are kept 90 degrees apart, and usually, if you see, and if like usually whenever there is a higher energy tube, okay, with the tube X-ray tube with the larger kVp, it will have a larger FOV. Okay, here like usually it will be around 50 centimeter, and the tube with the lower energy will have a smaller FOV, which is 26 centimeter. Okay, so the FOV is different from each other. Okay, so and one more thing is this data set is acquired together. Okay, it's not that first 80 kV will work and then it'll and then you'll go for 140 kV. It doesn't work like that. It works. Yeah. So what I was telling is. Yeah, so it is not like 80 kV will take the scan first and then 140 kV scanner will start. It works simultaneously. Okay, both the acquisition is taken together, because of which you will get a very excellent temporal resolution. Okay? So this is all about a dual source, dual energy CT. Okay, this is like it becomes very expensive because of two X-ray tubes, but it will provide you excellent temporal resolution when you compare it with other technologies, which you will be seeing in the further slides. Okay, next you have something called as single source dual energy CT. Okay, single source dual energy means there is one X-ray tube, but you are providing dual energy acquisition with this. How can this be done? This can be done with the change in the voltage quickly. So what will happen? The tube will be built in such a way that it will be capable of switching between the two voltages rapidly. Okay, so like if there is a rotation which is going on, there is if you are taking a helical scan, there is one rotation of the X-ray tube will take place at 80 kV. Quickly, the X-ray tube will switch its voltage, and then again it will take an rotation at 140 kV. So rapidly it will be switching the voltage and it will be acquiring the scan. Okay, so the tube voltage is altered high and low multiple times within the same rotation. So because there is continuous uh, uh, switch in the voltage, you get the images with multiple kV techniques. Okay. Also, one more thing which comes up with this is if the tube is switching rapidly, the detector as well as the data acquisition system, okay, should be capable enough and fast enough to detect those X-rays, can absorb those X-rays, to send it to the DAS, and then put it in front of the display. Okay. It should be that quick that it is doing all this capturing, absorption, converting, all those things, and then it should be getting back to the detector should get back to acquiring another set of data. Okay, this is about single source dual energy CT. Then we have single source twin beam dual energy CT. So here what happens? Here the X-ray tube is single, okay. But in the X-ray tube, you know something called as filters, right? So you use filters in X-rays, in radiography as well as CT. So what happens is you will use filters of two materials, okay. These filters of two materials will be kept soon after the X-ray tube. So before the radiation reaches the patient, it will be connected to the X-ray tube. So when the radiation will come out, it will come out with a specific energy. Okay, but it will pass through the filters, which is made up of two materials. So one material will convert that radiation to 80. For example, if I'm taking 80 and 140 kVp, so one filter will restrict or reduce the kVp to 80, and the other type of other material of the filter, which is made up of other material, will convert the radiation to 140. Okay, so this is about the single source twin B dual energy CT. Next, we have single source consecutive dual energy CT. This type of CT is there across in some of the hospitals. Yeah. So what happens is the two helical scans will be acquired consecutively at different tube voltage. Okay. First, what happens? You'll take the scan in 80 kV, then the scan will continue in 140 kV, and then both the image or the data set is overlapped. Okay, both the things will be, I mean, data set will be overlapped and co-registered together. Okay, uh, so this is how the single source consecutive dual energy CT works. So because the data set is occupied at two different ways, or in the two different techniques, what will happen is this will drastically reduce the temporal resolution. Okay, temporal resolution is one of the important things which we call it as an advantage in spectral imaging. But when you use single source consecutive dual energy CT, what happens is this will reduce the temporal resolution, which will not live up to the standards of the spectral imaging. Okay. These are the types of source-based dual energy CT. So now we will go on to detector-based dual energy CT. Okay. There are a couple of technologies which has been developed in detector-based dual energy CT. Okay. So one is nothing but dual layered imaging. Okay, dual layered dual energy CT. So what will happen is the detector will have two layers, the top layer and the bottom layer, or you can call it as innermost layer and the outermost layer. Okay, so the top layer or the innermost layer of the detector absorbs all the low energy photons, and while high energy photons, they will pass through the low energy or the top layer of the detector, and it will go and get absorbed in the bottom layer or the outermost layer. Okay. If you see here, uh, this blue are the low energy radiation. It will go and accumulate in the top half of the detector or the top layer of the detector. Okay. But the high energy, it will pass through them. It will pass through the top half because it is a low energy part of the detector, right? It will pass through that, okay, and then it will go to the high energy photons will go and accumulate in the outermost layer or the bottom layer. Okay? This is how the two types of energies are absorbed and converted into images. This also because you are acquiring the data at a single data set, okay, uh, and not separately, you will have a very good temporal resolution. Okay. Next, we have one of the very important advancements in spectral imaging. You saw the advancement CT, that is spectral imaging. And in spectral imaging, you have a very important advancement which people are talking a lot these days. That is photon counting detector or the photon counting CT. Okay. So what does it do? So usually, unlike a conventional CT, which integrates X-ray intensity, you get the image rate based on the X-ray intensity. Unlike that, in photon counting CT, the photon, each individual photons are counted and they are measured. Okay, their energy is measured. Okay, this technology offers very high spatial resolution. It will also give you very improved contrast and material differentiation. Okay, when you compare it with conventional CT. Okay. So what happens is as the photons are getting counted and absorbed, and then later it is measured, it will allow for a very precise differentiation between tissues, okay, such as calcium and calcium from iodine in iodine enhanced contrast media. So usually in these cases, the differentiation of the tissues will be very high and will be useful for detecting the specific substances. For example, in case of gout, and if you want to measure the uric acid, or uh, if you want to measure the iron contents in while doing the liver imaging in all those cases, this type of CT scanner or the detector will play a very important role in differentiating between the two. Okay, this is all about the technologies. I mean, there is a lot to talk about photon counting CT. It is a separate topic itself on its own, but I wouldn't want to. I don't want to discuss it right now when I'm talking about spectral CT. But yeah, this is one of the very important technology, and moving forward, this technology will be one of the very important use case in the Department of Radiology. Next, you have acquired the data. Let's move on to see how you process the data, okay, and how you do the reconstruction of the data. Okay, this is very complicated process when you compare it with the conventional CT scanners. The data set which is processed, the whole process is uh, a little complicated. Okay, so there are two ways in which the data set will be processed. One is image domain decomposition, the other one is projection space decomposition. Okay. So what happens is, so when the image in the image domain decomposition, once the image is generated by linear or non-linear sigmoidal blending of both, that is your high energy and low energy uh, what data sets, the post processing or the processing takes place. Okay, if you are talking about the linear blending, like you can blend it in two ways. You can blend it in linear way or a sigmoidal way. Okay? In linear blending, a specific ratio of your high energy and low energy data are used. Okay, certain number of low energy data is used and certain number of low energy high energy data is used. Both are registered together, and then you get to view the images. Okay, and if you are using the sigmoidal blending, the pixels with the higher attenuation, like if you are taking you'll take a low energy data set, okay, with the low energy data that is acquired at 80 kV or something like that. So the pixels which has very high attenuation, that you will select, okay, and the pixels with low noise or very less noise are selected from the high energy data set. Yeah. So from the low energy data set, you take the pixels with the very high attenuation, and from the high energy data set, you take the pixels which has very less noise. Okay. So with this, the high attenuation pixels and the low noise pixels will be taken together, and it will be combined and registered together to produce an image. Okay. So because of this, you'll get a material specific images by calculating the difference in the attenuation of varying materials between low and high energy image data sets. Okay. So you can do, as I told, like if I have to explain to you guys again, first what one thing you have to do is you have to register the data. You have to overlap both the data, right? You can overlap using linear technique, blending technique, or sigmoid blending. Okay. In linear, you take a specific amount of high energy data and you take the specific amount of low energy data. You combine it together and then you do the processing. But when you're talking about sigmoidal, what you do, you from the low energy data that is acquired at 80 kV, you take the pixels which has very high attenuation. All right, you take it and keep it aside, and then you go for a high energy data set which was taken at 140 kV, and then there you will have images with uh, less noise, right? Because it was acquired at a very good case. So this high uh, energy, this low noise pixels from the high energy data set is taken out, and then both will be registered, and then you get the post process image. This is all about the image domain decomposition. Next, we have the projection space decomposition. So what is projection based. So it is a more robust processing, and it is always preferred. The high and low energy data sets are calibrated and aligned in the projection space to generate material density image and monochromatic images. Those are the two types of images how it will be displayed. Okay, so both the data sets are calibrated and aligned together, overlap together, and then we get the material density image and monochromatic image. So the commonly selected dual energy basis material pair are iodine and calcium, and iodine and water. Okay. So you focus on these two things. Okay, so two separate sets of material density images are generated. So iodine density images will be generated separately, and water density images will be generated separately. So when you do like this, what will happen is the lesion which contains iodine will show the higher attenuation on iodine density images than the water density images. When you are focusing on water, the water will show you the higher attenuation on the water density images compared to the iodine density images. So if you want to see if there is any structure which is iodinated, or if you want to see high iodine or high density structure, what you have to do is you have to do the post processing and open the iodine density images, which will show the higher attenuation for iodine. Okay. So these are the two types of processing. Now we'll quickly move on to the image display. Okay. So the images are displayed in two ways. Okay. One is material density display. The other one is monoenergetic image display. Okay. So the material density display can be iodine density display or the water density display. If you want to open the iodine density display, the higher attenuation iodine will be showcased more prominently. And when you want to see the water density display, the water attenuation will be seen more prominently. Here it is an iodine density display of the image, which you can see here. In density display, the enhanced organs containing iodine will appear bright. Okay. Rest of the areas will remain dark. If you see here, there is a you can see the spines and the calculi, and then you can see the renal pelvis, which is highly enhanced. Okay, this is how the material density display will look like. If you have seen the dual energy images, overlapped images, this is how it will look like. Next, we have monoenergetic display. So here, images are processed at any given KVP from dual energy datasets. Okay, so you will reconstruct it in multiple KEs. Okay, so virtual monoenergetic images at lower KVP, what will happen is, so whatever is there at lower KVP, that is, for example, uh, at 40 KV, it will show very good image contrast. Okay, and make small anastotic lesions more conspicuous than the routine ones. Okay, routine is which is at 70 kV. Okay, but however, the images at lower kV will have more noise, right? And the images will have and the higher I mean, so if I have to see explain with this diagram, if you see this, this is the image which was taken at lower kVp. This is the optimum 70 kVp images which is taken, and this is the 160 kV which is at the higher kVp. Okay, so when you see this, you'll have a very good contrast. Okay, but the amount of noise also which is filled with this is also very high. Okay, so but when you see here, the contrast differentiation is kind of less when you compare it with 40 kVp, but the noise is very less, which makes the image very clear. So because of this, you come to a conclusion where you see somewhere around optimum image contrast, and the noise is also kind of less. So you take images with, I mean, you visualize the images with 70 kVp or something like this. Okay, so this is how the like basically what I'm trying to tell is you will be post processing the data in all the energy levels. Okay, and typically if you want to see the higher contrast, you go for 40 kVp. Okay, but if you because if the noise is very bad and if you are not able to visualize it, what you do is you come somewhere in between 70 and 140 kV and see if the image will have optimum contrast with the less noise, and then you visualize those images. Okay. This is how monoenergetic image display work. So this is all about your spectral imaging, your types of acquisitions or the techniques where the dual energy scanners are used. Then how does the images or the types in which the data is processed, and how the types in which the displaying is done. Okay, so this is all about that. But now, when we see the difference between the conventional CT and spectral CT, this will give you a very good understanding uh, of how the conventional CT is different from spectral CT. All right. So if you see the X-ray source, you use a you use a single source with a single level of X-ray energy, right? But when it comes to spectral CT, you use either you can use dual source, okay, but you use a single source which is capable of producing energies at different levels. Different energy levels. Okay, that is one of the difference between your spectral and conventional CT. The other difference is regarding the image formation. Okay, so here in conventional CT, it generates the grayscale images based on the total X-ray attenuation. Right. Okay. But when it comes to spectral CT, it differentiates materials by analyzing how tissues absorb different energy levels. Okay. Some of the tissue might like absorb will have a certain attenuation coefficient, and some will have a different attenuation coefficient, and it will differ from the KVT that is being used. Okay. Now let's go to material differentiation. So there is limited differentiation between bone and soft tissues, but or bone and bony structures. But when it comes to spectral CT, what happens is if you have a material of specific somewhat same density, it will be you will be able to differentiate between the two. Okay, like iron and calcium, you can distinguish between two. That is how the differentiation of material will take place. Next, if we have to talk about the contrast agent which is being used. Okay. It require like if you see conventional CT, you have a specific amount of contrast media which is being used if you want to see the if you want to delineate the structures in a better way. Okay, but when it comes to spectral CT, uh, there is a technique which is called as virtual monochromatic images. Okay, where virtual monochromatic images where you can take the images at different energy levels. So what this will do is, if you are taking the if you are using the virtual monochromatic images software, okay, and if you are taking the images at 40 to 50 keV, what it will do is it will enhance the contrast. Okay, if I have to show you here, see here there is already enhanced contrast, right? In the structure. If you see the 40 kVp structure, so it is already you can see the enhanced contrast. It has noise, but the contrast media is also the contrast in the image is also enhanced. So because of which the amount of contrast media which you can use to see the structures in a better way can be reduced. For example, in abdomen cases, if you are using some 60 to 80 ml of contrast media, if you are using spectral CT with virtual monochromatic images, you can do the same scan at 40 ml of contrast media, right? So because of which, if you can reduce the amount of contrast media which is used specifically to half of its initial value. Okay, if it is 80, you can do the scan at 40 uh, uh, ml of contrast media with the virtual monochromatic images. Next, let's go to radiation dose. So you know the specific or the standard radiation dose which is there in conventional CT. But some of the spectral CTs may have slight increase in contrast media. Some of the spectral CTs may slightly increase the radiation dose. For example, your dual source CT, or if you have to take the example of uh, CT where the acquisition is done separately at 80 kV, and then again after that rotation, again you will be acquiring the data in 140 kV. So in these cases, the radiation dose might be slightly higher. And but if you see the advanced methods like photon counting CT, in these methods you can you can usually reduce the radiation dose. Like here there is a mixed. Uh, You can increase the dose sometimes, and then the radiation dose will be decreasing some of the types of acquisitions. If you see the clinical applications, you know the clinical applications of conventional CT, which is being there all this right. But when it comes to spectral CT, what is not there in conventional CT is the advanced tissue characterization. So you get to know what type of tissue is it, what is it made up of because of spectral CT. You also get to know the composition of the tumors. If there is any tumor which is present in any of the part of the body, it can be, you can find out what is it made up of. Okay, you can find out the detection, you can find out the gout if it is there, and if there is accumulation of uric acid uh, in there. Okay, you can also differentiate the type of kidney stones. You have multiple types of kidney stones, and because of spectral CT you can find out what kind of renal calculi is present in that particular patient by doing the analysis. Okay, so this is where spectral CT is different. I mean, it gives an edge over conventional CT. Okay, so the technology which is used in conventional CT is single energy X-ray detectors and the tubes. But in spectral CT, you can have a dual source CTs. You can have photon counting detectors, right? You can have single source where the KVP is switched quickly, right? So these are the few technologies which, I mean, I've already spoken about the technologies. So those are the technologies which is different from the conventional CT. So this whole slide will give you a picture about how spectral CT is different from conventional CT, and will give you a better understanding of spectral CT as well. Okay. Yeah. Now let's go on to the advantages. It's I've already told in the previous slide, or the slides which I've already discussed about previously. So one is it will give you a very good tissue characterization. You'll get to know what kind of tumor it is. You get to know what kind of what materials, what tissues are present in a particular image. Okay, so it will also help you with the lesion detection, like what kind of lesion it is, what is it made up of. Okay, it will help you, as I told you, it will help to take the images with the lower contrast agents. Yeah, so you don't have to give a lot of contrast media for a particular image if you are using the PMI software. Okay, and then you have enhanced material decomposition. So if you have structures which is similar in is build quality, you don't do if the because of this in conventional CT, it will be provided with a similar HU unit, HU value, which will make it difficult for the radiologist to understand what kind of tissue is it. But when it comes to spectral CT, it will help you to differentiate between the type of tissue. Okay. So these are the advantages which is there in the spectral CT when you compare it with the conventional CT. Now let's move on to the applications. First is as I told you, tumor characterization. So different it can differentiate tumor tissues from surrounding normal tissue by analyzing the adenine. Okay. And it will also help in the detection of the smaller lesions by using low energy virtual monochromatic images. As I showed you in the previous slide, it will increase the contrast, because of which it will be easy to detect the smaller tumors, okay, which can go unnoticed in the conventional CT. Okay. Next, when you talk about CT angiography, it will enhance the blood vessels with the lower contrast doses. As I told you, if you are using monochromatic images, already the contrast in the image will be high, because of which it is not necessary for you to give extra contrast medium, right? So because of which, if you are talking about CT angiography, your enhancement of the blood vessels will be typically high with the lower contrast doses. So you don't have to give a lot of contrast media when you are doing angiography or any other case. Okay, which will also help particularly when you are scanning the patients with acute kidney injury or CKD, right? Okay. Next, one more application is in the differentiation of the plague. Okay, it can identify if the plague is calcified or non-classified in coronary arteries or any of the vessel, which is and in terms of coronary artery, it is very crucial for the assessment of the heart disease. Right. So, so you get to know if that plague is calcified or not calcified. Next, one more application is to identify the uric acid decomposition in the joints, which will be usually happening in case of gout. Okay, so because of which you get to know the uric acid if the uric acid is present in the joints or not. Okay. Next, it will also help in the subtle in the visualization of subtle fractures or early bone injuries. It will also help in the reduction of artifacts which is usually seen in patients with implants or any patient has undergone any joint replacement surgeries or anything as such. Okay, so this will also prevent and help in reduction of the artifacts. Okay, next is to in case of kidney stone, it will, as I told you, it will be helpful and will be useful in identifying the composition of the stone to guide the treatment. So there are different types of things. You get to know what kind of renal calculi is present in the particular patient. Okay. And in case of next one is in case of the patient who has renal insufficiency, or if the patient has CKD or AKI. In that cases, it is not advisable to give the contrast media, right? Because it will be harmful for the patient. Okay, so in those cases, if you are using a VMI technique where the contrast is already high, there may not be that much necessity of giving the contrast media. And if you want to give the contrast media also, you can do the or you can do the case with the lower contrast dose. Okay, these are the applications. There are multiple applications, and if you can differentiate these applications in terms of even I mean, cardiovascular imaging or renal imaging. You can differentiate it in different ways, right? In terms of radiation dose reduction or contrast agents, reduction in the contrast agents. You can divide it amongst several categories, and you can put in a lot of applications. Okay. Next, a couple of more slides. Yeah. So one of the limitation is increased radiation dose, right? So if you are using the not in all the type of scanners, but in some type of technologies, there might be increase in the radiation dose. For example, if you are using a dual source CT, or if you are using rapid KVP switching CT, it might require higher doses, compare it with your conventional CT. Okay, so that is one of the limitation. Then is higher cost and limited availability. So spectral scanners, spectroscopy scanners are very expensive. It is if you talk about the cost, it is as much as similar to what we are if we are getting a, 3 Tesla MRI of any of the manufacturer. The spectral imaging CT will cost much more than that. Okay, so that expensive it is. It is not at all cost effective because of the advanced detector technology which is being used, the computational processing which is completely different from conventional CT is being used here. So because of which the the the, the, it comes with very higher cost. Okay, and it involves a complex image processing and interpretation spectrum. So, I mean, basically, what happens is you may not see when you are using the computer because you just have to do a couple of clicks and then the processing will take place. But the mathematics and the permutations and the combinations which is involved inside the computer where the processing is taking place is very complex. All right. So it is not as easy as you sit in front of the computer and like you just click a couple of buttons. That's all. To work on it, it is very complex. It seems a little easy for us when we sit and work on a computer. Right? So that would be one of the limitations when it comes to the manufacturing side. Uh, and then the last one is limited temporal resolution in some techniques. As I told you, as I was explaining the technologies, I might have told you some of the techniques such as rapid QVP switching or dual layer detectors, they may have slightly lower temporal resolution compared to the conventional CT because the images are required multiple times. Right. It is not a single acquisition. The images were acquired at a high KVP once and then will go back to the lower KVP ones. Because of this reason, the temporal resolution might be low. Okay. These are a few of the limitations which is coming with the spectral imaging. If I have missed out on a few, if you feel you can add something about the advantages or the limitations, you are very free to add because I might have missed out on a few. Okay. If I have to conclude this, spectral imaging in CT is like you all know that it is transforming the diagnostic imaging setup by providing better material differentiation, reducing the contrast agents which can be provided to the which has to be given to the patient, and radiation dose also sometimes will be increased, sometimes will be decreased. But again, with the rapid advancements, the scanners will be built in such a way that the radiation dose also will come down. And it will also improve the disease characterization across various fields, where you do not have to use multiple diagnostic techniques to identify what kind of lesion it is, what is it made up of, what is this, and what is its characterization, because uh, everything can be taken forward with the help of the spectral CT. And with the recent developments such as you can see about the photon counting CT or the detector, which for which ultra high resolution imaging is being uh, there. And then if like once you integrate the AI for image processing in the spectral imaging and analysis of the data, and with the help of the development of targeted contrast agents for molecular and functional imaging. Again, if you are targeting the contrast agents to a specific part, you don't have to give a lot of contrast media. First of all, from conventional to spectral imaging, you have reduced the contrast media to 50%. Again, with the targeted contrast agents, again, it will go down. Uh, Spectral images, I can say that spectral imaging can definitely be a game changer, right? Uh, so these are the few of the references which is reference or the literatures which is uh, available in the website and the databases. You can freely find them out by searching about spectroscopy or any of the specific things inside the spectroscopy. Right? I've used this to make this PPT. Uh, if I have missed out on anything which you guys know, you can just educate everybody in the QA session, right? So this is all about the topic beyond conventional CT, that is revolutionizing radiology with spectral imaging. Thank you so much.
Thank you, sir, for the valuable talk. I ask all the participants if you have any questions, please do put it in the chat box. Sir, one of the question is that no, I couldn't able to understand the image formation and monochromatic image display. So if you could answer how it works.
Okay, give me a second. Monochromatic imaging display, right?
Yes, monochromatic image display.
Usually what happens is here the processing will take place for both the KV sets. So you will be acquiring the images both in higher KVP and lower KVP. So what happens usually is you will process both the data, all right, and then post processing, you will collect the data in different KVP levels. That is 40 kV, 50, 60, 70, 100. All these things will be reconstructed. All right. So once we get the reconstructed data, the data will be in such a way that wherever you are using a 40 kV reconstructed data, this data will have very high contrast differentiation. Okay, the contrast differentiation will be very good when you see the very low technique. But when it comes to high, there won't be noise. The image will be much more smoother than the 40 kp or the lower kp images. But the contrast differentiation will be very less. You can see this in the image which is there in this screen as well. You can see the difference in contrast between the two types of data. Right? Yeah. So what happens is if you are able to visualize any particle, you can take in this 40 keV data and the radiologist can sit and report on that. Okay. But if you feel that the noise is little more, you can take in the reconstructed data where the noise is slightly less, but the contrast differentiation is more better. Okay. So by doing this way, you will be able to differentiate between uh, the pathological conditions in terms of the contrast. And this will also help in reduction in the contrast media because already if there is improved contrast in the images, you don't have to give a lot of contrast media to see the structures in a better way. Okay, you can reduce the amount of contrast media when you are using these kind of image displays. I mean, you can process it both the ways. You can, this anyways will be there. So because you are using the spectral imaging, you can reduce the amount of contrast media which is being given. Which is the next question is which is best in CT, monochromatic images or the polychromatic images? Obviously, it is polychromatic images, just that it is coming out with the very big disadvantage of the price tag which is involved with this. Okay? This is very expensive, so every hospital may not be what do you tell? May not be, may not able to use the spectral imaging systems. So that is why it is not at practice at the larger extent. But when the prices will come down, I feel the spectral imaging market will, boost.
Sorry, another question is that what type of filters do we use in twin beam sources?
Sorry, I did not.
What type of filter do we use in twin beam sources?
What uh, what type of filters are used in twin? Okay,
Twin beam sources.
Indeed. Okay, okay, okay. So usually, see, there should be two types of when you're splitting the beam, you will have to use two types of filters, right? One of the filter will be having sufficient energy, like aluminum, uh, which will what do you tell, which will reduce the absorption rate of the filters. So that is where you get the 140 keV. Okay, then you can use a filter which has slightly higher atomic number, which will absorb slightly more uh, radiation, because of which you will get a 80 keV image. So when you keep this differentiation between two types of materials based on the atomic number, you will get you can use the atomic number. You can differentiate between the energies of the X-ray.
Sir, another question is that how CT will detect the lesions or tumors?
Uh, how CT will detect the lesions of the tumors? Yeah. So if you have seen CT this thing, so everything is based on the contrast which is there in the objects, right? So you will see a normal anatomy, and if you feel there is something which is high point and structures are there. If you're seeing there is an object which has slightly higher contrast than the compared one, what you do is you typically find out the SU value of that. Okay. For example, there is a liver. You're seeing a liver. Everywhere in the liver, the Hounsfield unit of the liver will be similar, almost. Okay, but there is a hyperintense structure which is bright in color. Okay, so what you do? So after the contrast media I'm talking about, this is after the delay. Usually, if the lesions, if it is there, this will be the contrast in the lesions will be slightly more. At that time, what you do is you check the Hounsfield unit at that structure. So if the Hounsfield unit is not matching with the surrounding area, that means that there is something else which is there instead of, in the normal case, right? So then what you do, you have to find out what kind of tumor it is. Then, it may be cyst as well. Cyst will have a specific Hounsfield unit. Okay, so it will be easy for you to diagnose, to understand if it is a cyst or a tumor. If it is a tumor, it will have a specific Hounsfield unit. So what you do is you then undergo a biopsy and then you find out what kind of tumor it is. So everything will be based on the Hounsfield unit, which will be measured while the radiographer, while the radiologist is diagnosing or doing the reporting.
So the next question is that whether imaging in the same slice with two energies increase the radiation dose.
The same slice with yes, definitely this will increase the dose. That is where when I was talking about the limitations, I was just explaining that just explaining that in certain type of spectral imaging, there are technologies where you use either dual energy, single source dual energy CT, where the energies will be slightly increased when you compare it with the uh, conventional CT scanners. But the advantage, I won't say it is a limitation with us. One thing is, if you want to see the differentiation in particular things, spectral imaging will help you with a lot of data, right? It will help you in diagnosis. And because the medical imaging is revolutionizing every now and then, we will, or the researchers will find out a way in which the radiation dose will be reduced, or if we can get down the radiation dose when you are using the uh, dual energy CT. Okay, for now, yes, there is increase in the radiation dose, but it may not be that like effective, efficient when you compare it with the, the pathological differentiation that you will get. Okay, there are two more questions on low noise VMI. Okay, so low noise VMI, as I told you, and so what happens is low noise VMI. Okay, so what is VMI? VMI is nothing but virtual monoenergetic images. Okay, so what happens is, if you are taking an image with a if the image is reconstructed with very low KEV, what will happen is it will already have a what do you tell? Uh, One second. There are two questions. One is images are for, like, it is about VMI. Okay, and the other one is how DECT will impact the angiography, as we are already using the contrast media. I'll be answering both the questions with the help of VMI itself. Okay, because that is the technique which is involved here. Okay. So I expect both of you to listen to this carefully. So virtual monoisotope images, what it will do is, again, it will take in the data and it will reconstruct all the images in different KVs. Okay. Once the image is reconstructed at 40 kV, what will happen, or the lower KVP, not even 40, 40, 50 or 60, any KV, these will have very high contrast. All right, the contrast difference in between the structures will be very high when you are seeing the low KV images. So, because of which, what will happen is, if you are going to give if you're going to give the contrast media, you don't have to give that much contrast media. For example, someone has asked about the angiography, right? You give around 80 to 100 ml of contrast media while doing angiography cases. Here the structures are already better delineated. So you may not have to give 80 to 100 ml of contrast media. You can reduce the amount of contrast media. In case of angiography as well, in case of giving 100, you can give about around 50 ml of contrast media or 60 ml of contrast media. So this VMI technique will produce the images with the lower KVP, which will have better contrast difference, because of which you will get a better image. Okay. So because of this, the contrast media will be reduced. I hope you understood this point. It's all about reducing the contrast media and uh, uh, not canceling the use of contrast media. You have to use the contrast media, but in a very uh, less quantity.
Are there any more questions? So I think the topic was clear. So thank you so much for the session, sir. So I'm sure all the participants were enriched by the knowledge of advancements in CT, especially with different configurations in CT and in dual energy CT, as well as the working principle and applications of spectral CT as well. So before we conclude, let me brief the participants about our next speaker for tomorrow. We will be having Ms. Blossom Fernandez, PhD scholar in neuroimaging and interventional radiology, Department of Psychiatry, ANS Nimans, Bangalore, Karnataka, who will be taking a session on advanced neuroimaging techniques and analysis. Once again, thank you so much for this session, sir, for your time and contribution towards this webinar. Thank you to all the participants who were present. We hope you have found the session both informative and useful. We look forward for welcoming you once again tomorrow in another enriching session. See you all tomorrow at 11 a.m. Until then, take care, stay safe, and have a wonderful day. Thank you.
I would like to take this opportunity to thank the organizers, Mr. Swapnil, and the whole team of Medical Imaging Technology from the College of Acharya Institute of Allied Health Sciences. And I would also like to thank all the participants for joining in this session. I hope there are much more amazing sessions which is lined up. I hope you all will listen to it, and then enrich your uh, knowledge about medical imaging. Thank you for the opportunity. Yes. Thank you so much.
Thank you, sir. Thank you.